Okay, first things first, let's just bust the biggest myth right off the bat. The name itself comes from the Greek words for split mind. But, and this is a big but, it has absolutely nothing to do with a split personality. That's a totally different thing. What it's actually describing is a fragmented or scattered pattern of thinking. And that's a really key thing to understand from the start.
So, here's our game plan. We'll start by unpacking what a fragmented mind really means. Then, we're going to dive into the three main types of symptoms you'll hear about. After that, we'll look at how the illness tends to progress and how it gets diagnosed. We'll also explore the big puzzle of what might cause it, and we'll wrap up by looking at the path to treatment.
Right, so let's talk about this idea of a fragmented mind. It is so important to know that schizophrenia isn't just one single thing. Doctors call it a syndrome, which basically means it's a collection of different symptoms that can show up in all sorts of different combinations.
And because it's a syndrome, what one person experiences can be very different from someone else. It's this whole cluster of related symptoms. But to make sense of it all, we can actually group them into three main categories.
So those three categories are really key to understanding the whole picture. We call them positive, negative, and cognitive symptoms. Let's break down what each of those actually means. Now, the names here can be a little confusing. Positive symptoms doesn't mean they're good. A better way to think about it is like math. It's the addition of something that isn't normally there, like a fever. On the other hand, negative symptoms are the removal or subtraction of normal functions, like a loss of interest or emotion.
So these positive symptoms, the ones that are added, are what people often think of first. We're talking about things like delusions, which are these really strong false beliefs that a person holds on to no matter what, and hallucinations, which are sensations that aren't real, like hearing voices. This category also includes things like disorganized speech and behavior.
And to give you a really clear idea of what that disorganized speech can sound like, this is a perfect example. It's sometimes called a word salad. It's just a jumble of words with no logical connection, which you can imagine makes it pretty much impossible to follow what the person is trying to say.
Then you've got the flip side, the negative symptoms. This is where things are taken away. Flat affect is a big one. It's a really reduced emotional expression. Like, imagine a monkey just started playing in your living room and your reaction was nothing, just a blank stare. Then there's alogia, or poverty of speech. You might ask, do you have any kids? And the answer might just be yes. No details, no story. And finally, a volition is a major drop in motivation to do, well, pretty much anything.
And the third category is the cognitive symptoms, and these can be a lot more subtle. They mess with the brain's basic processing, things like memory and what we call executive function, the ability to plan and organize your thoughts. So for example, someone might have a really hard time holding a phone number in their head while you're also telling them an address. Their brain's workspace just gets totally overloaded.
Okay, so we've got these different types of symptoms, but how does the illness actually unfold over time? And how do doctors get to the point of an official diagnosis?
Well, it often follows a kind of pattern, broken into three phases. It can start with what's called the prodromal phase, where a person might just seem more withdrawn or isolated, kind of like what you might see with depression. Then comes the active phase. This is where the really severe symptoms, like hallucinations and delusions, pop up. And finally, there's the residual phase, where a lot of those active symptoms might fade, but the cognitive issues and withdrawal can stick around. Now, for a doctor to officially diagnose schizophrenia, there's a pretty specific checklist they have to follow. A person needs to have at least two of the main symptoms we've talked about. And here's the crucial part. At least one of those symptoms has to be one of the big positive ones, so delusions, hallucinations, or disorganized speech. And of course, they have to rule out other causes like substance abuse.
And here's the other kicker. Timing is everything. These signs and disturbances have to be going on for at least 6 months straight. And within that 6-month period, there has to be at least 1 full month of those intense, active phase symptoms. That long duration is what really helps doctors separate schizophrenia from other psychotic disorders that might be more temporary.
So all of this brings us to the million-dollar question, the one that scientists have been trying to answer for a very long time. If we know what the symptoms are, what's actually causing all of this to happen?
So yeah, what is the cause? Well, the honest answer is, we don't know for sure. It's still one of the great mysteries in neuroscience. Part of the reason it's so tricky is that the symptoms are uniquely human, which makes them really hard to study in, say, a lab mouse. But we do have some major clues.
For a long time, the leading theory has been the dopamine hypothesis. The basic idea is that maybe the brain's dopamine system is overactive.
It might be making the brain treat random neutral things as incredibly important, which could be what fuels delusions and hallucinations. Genetics also play a massive role. Twin studies show a really strong hereditary link, but it's not like there's one single schizophrenia gene. And it seems environmental factors, like maybe an infection during pregnancy, could also be part of the puzzle.
We get another fascinating clue when we look at who gets it and when. It shows up a little more often in men, and it tends to start earlier for them, usually in their mid-20s. For women, it's more common in their late 20s. Some scientists think that hormones like estrogen might actually have some sort of protective effect, which could explain why it often shows up later and can be less severe in women.
All right, so let's finish up by talking about the path forward. While finding the right treatment is definitely a journey, we know that a combination of different approaches can be really effective for managing the condition.
And the number one thing to understand here is that treatment is absolutely not just about prescribing a pill. The best, most effective approach is a full-on team effort. It combines therapy, counseling, and medication to build a complete support system around the person.
Now, antipsychotic medications are, of course, a huge part of the picture. They can be very, very good at reducing symptoms, especially the positive ones, mostly by working on brain chemical systems like dopamine. But they're not a perfect fix for everyone, and they do come with important things to consider, like side effects, that have to be managed really carefully by the whole clinical team.
And that really leaves us with one final thought to chew on. We've gone from the myths to the symptoms to this massive scientific hunt for a cause. So as our understanding of the brain and genetics gets deeper, the really big question for the future is this: how can we move from these broad treatments we have now to therapies that are truly personal and precise, targeting the specific root of the condition for each and every person?